This demonstration is provided for patients with diabetes with needs for insulin injections. In order to properly manage insulin therapy, patients may be required to mix different types of insulin in order to meet their body's needs. In this demonstration, we will discuss the different insulin types, general information about mixing insulin, and the proper technique needed to mix insulin. We will start off by reviewing the different types of insulin that are available. There are 4 categories of insulin. These are rapid-acting, short-acting, intermediate-acting, and long-acting insulin. Rapid-acting insulin is used 15 minutes before eating a meal and allows patients to coordinate their insulin levels with their meals. The effects of rapid-acting insulin peak in 30 to 90 minutes and last 3 to 5 hours. Examples of rapid-acting insulin are Lispro, Aspart, and glulisine. Short-acting insulin covers insulin needs from meals that are eaten within 30 to 60 minutes of injection. The effects peak in 2 to 5 hours and last 5 to 8 hours. Regular insulin is the short-acting insulin that is used, and it comes in brand names of Humulin R and Novolin R. Intermediate-acting insulin covers insulin needs for half of a day or overnight. It takes effect within 1 to 2 hours, peaks in 4 to 12 hours, and can last up to 18 to 24 hours long. Types of intermediate-acting insulin are NPH, which contains an absorption aid called protamine, and lenti-insulin, which contains zinc in place of protamine for diabetics that are allergic to protamine. Long-acting insulin covers basal insulin needs for a full day, but variations in insulin levels throughout the day must still be addressed with bolus insulin injections. Long-acting insulin works within 1 to 2 hours and can last up to 24 hours long. Some examples of long-acting insulin are Detamir and Glargine. There is a newer long-acting insulin that lasts up to 36 hours, and it is called Ultralenti. Please be sure to take a minute to review the different types of insulin before moving on to the next part of this demonstration. As we have seen, there are many different types of insulin. In most cases, multiple injections with different types of insulin are required to mimic the way the body usually secretes insulin. In order to cut back on the number of injections a person might have to give each day, sometimes 2 different insulin types can be mixed and given together. Before we discuss how to mix the different types of insulin, let's first take note the types of insulin that can and cannot be mixed. For the sake of simplicity, the insulin preparations referred to here will be grouped into the following categories: rapid, short, intermediate, and long-acting. You can refer back to the previous slides about which insulin products fall into these different categories. Intermediate-acting insulin can be mixed with short-acting insulin. Intermediate insulin can also be mixed with rapid-acting insulin. Long-acting insulin should never be mixed with any other insulin preparation. Once insulin is mixed, you should use it immediately. In order to prepare for mixing insulin, all supplies should be gathered, such as an insulin syringe, bottles of clear and cloudy insulin, alcohol swabs, and a sharps container. Wash your hands thoroughly with soap and water, and open the alcohol swab packages so they are ready when you need them. This diagram shows necessary supplies that you will need in order to mix your insulins. They include the 2 types of insulin, the insulin syringe, and the alcohol swabs. After taking off the lid of the bottle of insulin, write the date that you opened the bottle on the front. Insulin bottles should be thrown away 1 month after being taken out of the fridge and opened. Check for lumps, crystals, or colors that should not be present in both bottles of insulin. If any of these are present, the bottle should be thrown away and a new bottle should be opened. Gently roll the cloudy bottle because some of the components of the insulin may rest at the bottom of the bottle before you use it. The clear bottle does not need to be rolled. Never shake the insulin instead of rolling it because shaking the bottle will make bubbles and could damage the insulin. Then use an alcohol swab to wipe off the top of both of the insulin bottles so that we know that they are clean. Injecting air into the bottles will make it easier to draw up the insulin. The same amount of air will be injected into the bottle as the amount of insulin that you will later take from the bottle. Pull the cap off of the needle on the syringe. Make sure you draw back the plunger so that the black rubber stopper's edge is even with the number on the barrel indicating your prescribed dose of cloudy insulin. Hold the syringe like a pencil while holding the insulin bottle down flat on a table, and put the needle in through the center of the top of the insulin vial, making sure not to touch the rim of the bottle with the needle. Gently push the needle through the top until the entire needle goes in, then push the air in slowly, and remove the syringe. Air will go from the syringe into the insulin bottle. Repeat again for the clear bottle of insulin with the dose of insulin that you will need from that bottle. Make sure to do the air injections in separate steps so that we decrease the possibility of an error occurring. It is normally recommended to draw up the clear insulin first and then the cloudy insulin second. With the needle inside of the clear insulin bottle, turn the bottle and syringe upside down together as a unit so that the bottle is now on top of the syringe. Make sure the tip of the needle is below where the level of insulin is. Draw the insulin dose up slowly into the syringe because going too fast will bring in tiny air bubbles. Before taking the needle out, check for air bubbles. If bubbles are present, it means that air is taking the place of where insulin would be, so that your insulin dose would be too low. To get the bubbles out, push the plunger back up so that the insulin is going back into the bottle. Do this step until all of the bubbles are gone from the syringe, then redraw more insulin slowly. Once there are no bubbles, turn the bottle and syringe back over so that the bottle is flat on the surface again. Hold the syringe by the barrel and pull the needle straight out of the bottle and set it down on the table, being very careful not to touch the needle to the surface of the table. Touching the needle to the surface of the table will make the needle dirty and unusable. Repeat these steps with the cloudy insulin using the same syringe and needle as we did with the clear insulin. This will be a little different than before because we will be pulling the plunger back not only to the amount of the insulin we need, but pulling back to the line of the combined clear and cloudy insulin dosage amount. Now we have a mixture of both clear and cloudy insulin, so it's important to pull back very slowly so as not to get air bubbles into the syringe. We cannot push the fluid back into the vial because we have both clear and cloudy insulin, and pushing the mixture back in will make it so that the cloudy bottle of insulin is no longer pure. When you have no air bubbles, turn the bottle and syringe back over together as a unit and set it down on a flat surface. Take the needle out of the bottle and lie the syringe down on the table. Again, be very careful not to touch the needle to anything else so as not to make the needle dirty. Make sure to use an alcohol swab on your skin where you inject the insulin. Good locations for insulin injections include the stomach, back of the upper arms, upper buttocks and hips, or outer sides of the thighs. These areas are best for insulin injections because they have thicker layers of fat that help absorb the insulin and lack excessive nerves, making injections less painful. This diagram shows the 4 areas mentioned previously as the primary insulin injection sites. Note that the stomach area is considered the midsection around but not including the belly button. The outer thighs, back of the upper arms, and upper buttocks or hip are also good areas for these injections. In deciding where to inject your insulin, be sure to consider the differences between injection sites. Insulin is absorbed fastest from the stomach and slowest from the buttocks. Therefore, it is best to inject short or rapid-acting insulin in the stomach and long-acting insulin in other areas of slower absorption. Make sure to be consistent with injection sites. For example, all insulin before meals in the stomach, or all evening insulin in the thigh. It is important to rotate injection sites in order to minimize pain and bruising and maximize effectiveness. Do not inject in the same spot each time. It is okay to rotate within the area, but make sure to avoid injections near the belly button or into scars and moles. Dispose of the used syringe still attached to the needle into a red sharps container. Everything else can go into a regular trash can. Always dispose of the needle and the syringe when finished injecting. Be sure never to reuse your needles or syringes.